Now, before we start our next discussion, just a quick warning to Aboriginal and Torres Strait Islander viewers. This will show images of a deceased Indigenous person, because in January of 2016, a young Wiradjuri woman who was 6 months pregnant died of septicemia at a New South Wales hospital after making 20 visits over the previous 7 months. On her final hospital visit, Naomi Williams was in so much pain she could hardly move, but she was sent home without seeing a doctor with 2 Panadols. She and her unborn baby died 15 hours later.
On Monday, after a 3-year inquest, coroner Harriet Graham found that there was implicit bias and lack of Indigenous representation at the Tumut Hospital and Healthcare Services. So what's going on? Are our facilities taking Indigenous concerns seriously? Well, George Newhouse is with the National Justice Project and he represented Naomi's family at the inquest. And Professor Gregory Phillips is the CEO of Abstar Consulting, an Aboriginal-owned and operated consulting business that helps organisations in this field. They both join us here this morning. Thank you both for your time this morning. George, I might start with you. With this particular case, what's this inquiry been looking at and what's it found?
Look, the coroner looked at Naomi's very tragic death. She looked at her antenatal care in the months before she passed away and said that was substandard, very reactive. She wasn't referred to an obstetrician during her pregnancy, and it was a very difficult pregnancy. As you've indicated, she presented on multiple occasions to the hospital without ever receiving specialist care. Naomi felt unheard, she felt discriminated against and stereotyped, and she was so upset with the treatment she was getting. She actually was going to have the baby in Canberra. She was going to physically move from Tumut to Canberra.
And talk about the specifics of what she was undergoing. She was experiencing vomiting, nausea, sometimes diarrhoea, dehydration, and she was never referred to an obstetrician and never referred to a gut specialist.
No, that's absolutely right. She presented, as you've said, over a dozen times in the months before she passed away. She had really complex symptoms, and yet she was treated for the acute condition. She was often put on a drip and had potassium placed in her veins and in her body and rehydrated, but then there was no ongoing care. And Naomi attributed that to the way she was being stereotyped.
And she was referred to mental health services and drug and alcohol services, right? Even though the services had already determined that she had no dependence issues and in fact never had.
That's the tragic part of this story. Instead of being sent to an obstetrician or a gut specialist, she was sent to drug and alcohol, and they kept saying she doesn't have a drug and alcohol problem. It was this stereotyping that ensured that she didn't get the appropriate care.
The local health district has apologised to Naomi's family. What did her family make of that?
Look, the family don't want apologies through media releases. They want to see change. They want to see real change and permanent change, and they haven't seen it yet. Aboriginal people in the area still do not feel safe driving to Tumut Hospital. They'll go to Gundagai or Wagga, but until they're listened to, until they have a voice that enables them, and they feel that they're heard and they feel safe in that hospital, there is a real problem, and the family will not be accepting an apology.
Gregory, unfortunately this case isn't an isolated incident. We've had these sorts of cases before where Indigenous people have received very poor treatment and died as a result, and we've seen anger before as well. In the area that you work in, are things changing? Are things getting better at all?
In some ways they are, but in other ways they're not. What we've seen is, absolutely, these are not isolated incidents. What we're seeing in the media, Ms Williams' case, Ms Du, Dr Yunupingu, they're just the tip of the iceberg. And the evidence shows that at least 33% of Aboriginal people report racial discrimination in medical settings, some or all of the time. In Victoria, we know that Aboriginal patients in hospital settings experience racism 7 times more likely than others. So these are not isolated incidents. What we have seen universities, some colleges, some nursing schools, for example, do is to start to reform their curriculum to include more about Aboriginal and Torres Strait Islander health. What we haven't seen is a focus on racism. And we haven't seen that focus or measurement of racism and its incidence and its implications in the health system itself among employers.
Gregory, this might sound like a stupid question, but can you just define racism for us when we're having a conversation like this? Because I think a lot of viewers might think, well,
Sure.
Obviously a healthcare professional is going to do the best they can. They're not going to intentionally and willfully, because they think that Indigenous Australians are inferior to white people, let them die. What are we talking about when we're talking about this sort of racial bias?
Well, racism is both individual and systemic, and whether or not people intend racism or not, you're right, most health professionals don't intend it. Most people don't wake up and decide to be mean to be brown people or black people, but the intent of their actions, if they don't know that they're doing the wrong thing, can be very real, and that's being played out in the statistics. So whether we call it unconscious bias, implicit bias or racism, we're dealing with the same fact. And the same issue. And again, this is not just about individual actions or individual education of health professionals. It's also about things like workplace culture, policies, procedures and systems that impact on care. So if we're talking about racism, we have to talk about it at individual level and at systemic level.
Is it also an issue of Indigenous people not being represented in the staff at these hospitals?
Absolutely. We know that Aboriginal and Torres Strait Islander people are severely underrepresented in the health workforce. Now, we've made some great gains in that area in the last few years. For example, the number of Aboriginal medical students the number of medical students enrolling in Australia's medical schools is now proportional. So 3% of all enrolments are Aboriginal and Torres Strait Islander. So there's some great advances. But what we also know is that Aboriginal doctors, nurses, midwives, social workers are more likely to experience more racism themselves within the health system as health professionals.
George, when Gregory was just talking about it not being a problem of targeting just individual healthcare professionals, but the culture, I can see you nodding along. How do you address the culture?
Well, the coroner had some good suggestions, including proportional representation on boards and advisory committees at the hospital. At the moment, they don't have proportional representation. Aboriginal people certainly don't. She suggested that the Aboriginal liaison officers be available 24/7, that picking up on some of Gregory's points, that racism is measured and tools used to draw people's attention to what's really going on in the system.
Yeah.
You're agreeing there, Gregory?
See, we're focusing on the wrong thing. We're focusing on Aboriginal culture. Now, Aboriginal culture is important for non-Aboriginal people to understand in health and medical settings, but that's not the only thing that's important. The most critical thing for them to understand is their own culture and values and potential for unconscious bias or racism. And so we have to turn the gaze back from Aboriginal peoples as the problem and our culture back towards the system and those who are operating the system and how do they interact with us. That's the real issue. So cultural safety, this term we talk about, or cultural competence, in fact, they're actually euphemisms for the effect of racism in the system.
What needs to be done, George, in terms of training, not just for new staff, but ongoing for existing staff?
Well, it's a vital issue, and as Gregory picked up, the training colleges and universities are actually picking up this issue of unconscious bias or racism, and it is being picked up in training, but also professional standards need to change. Cultural safety needs to be mandated amongst all clinicians and medical professionals.
What does cultural safety mean?
Well, I mean, Greg just defined it. Greg, you just defined it.
There are three elements. Yes, there are three key elements in cultural safety. One is culture of the other, so in this case, culture of Aboriginal and Torres Strait Islander people. The second is culture of the self and having some critical reflection on one's own potential for bias and racism. And thirdly, it's about institutional, organisational and systemic reform. What we've seen nationally is health faculties and medical and nursing colleges start to deal with Aboriginal and Torres Strait Islander health and start to encourage more teaching about Aboriginal cultures. What we're encouraging them to do now is to turn the focus towards teaching about racism and unconscious bias. But what we don't have, and COAG has committed to a health system of free of racism and discrimination. So we kind of have the top and the tail turning their focus in the right direction. But what we don't have is employers and health systems now starting to take responsibility, because it's not enough to just educate health professionals or to have high-level targets. It's actually about where the rubber hits the road at the service level in the middle.
Gregory, the Garma Festival is going on this weekend. That's in the Northern Territory, and it's Australia's largest Indigenous cultural gathering, with a lot of leaders gathering to talk about these exact issues. Are leaders taking enough action here, and what would you like to tell the leaders who have been gathering at the Garma Festival?
Well, we Aboriginal and Torres Strait Islander people work tirelessly, endlessly dealing with racism and unconscious bias, actually. So we're actually not the problem. Who isn't taking responsibility are non-Aboriginal and Torres Strait Islander leaders or health professionals. And health professionals are starting to do that. But what we need is Director Generals and ministers and all of the people within health bureaucracies and hospital bureaucracies to not take this as a personal attack, but to see racism as a very real public health issue and to do something about it.
Gregory, George, great to talk to both of you. Thanks for filling us in.
Thank you.
And just a clarification, Ms Williams had made 15 visits to Tumut Hospital and 5 visits to a number of other doctors in the 7 months prior to her death.